Good morning. Thank you for joining us for another Ministry of Health virtual media conference on the COVID-19 response. Our panelists today are Dr. Mariam Richards, Principal Medical Officer, Institutions, Ministry of Health, Dr. Avery Hines, Technical Director, Epidemiology Unit, Ministry of Health, and we have Dr. Asante LeBlanc back with us, Chairman of the Trinidad and Tobago Cancer Society. I am Al Alexander, Senior Corporate Communications Officer in the Ministry of Health, and your moderator for this morning's media conference. We certainly have a packed agenda this morning, so without further ado, I invite Dr. Abdul Richards to present the clinical and parallel health systems update. Good morning, Dr. Abdul.
Good morning. Richards. Thank you very much, Al. Good morning to my colleagues, Dr. Hines and Dr. LeBlanc. We really appreciate your presence at our conference. Good morning to all members of the media. Good morning to the viewing and listening population of Trinidad and Tobago, and to all those who are tuned in locally, regionally, and internationally. This morning, I would like to provide an update on the status of the hospitals in the parallel healthcare system, with emphasis on the intensive care unit facilities, and also an update as per Media Release 903 that was released yesterday at 4 p.m. I'll start with Media Release 903, dated 9th of November 2021. An additional 305 positive cases were confirmed and reported in the last 24 hours. This now takes the rolling average to 321, and as Dr. Hines would have indicated, we have been noticing an upward trend for the past couple of weeks. The new positive cases has taken the total number of active positive cases to 5,758, and these cases are distributed as follows. There are 5,018 persons in home self-isolation being monitored by the respective county medical officers of health. There are 30 patients in step-down facilities and 405 patients in hospital. Later in my presentation, I will discuss the significance of the number of patients in hospital, but this is the first time, as of yesterday, that is the 9th of November, that the total number of patients in hospitals exceeded 400 persons. That trend was last seen on or about the end of June, on around June 28th. So between June 28th and yesterday, there were under 400 persons in the 9 hospitals in the parallel healthcare facility. Unfortunately, 9 persons lost their lives to COVID-19, and this takes the total number of deaths to 1,794. We would like to extend our condolences and deepest sympathies to the friends, relatives, and loved ones of the deceased. The total number of persons vaccinated with a first dose of a 2-dose regimen has been 628,467. Persons vaccinated with a second dose of a 2-dose regimen, 581,872, with 36,920 persons vaccinated under a single dose regimen. The total number of persons with a completed vaccination regimen stands at 618,792. And later in the presentation, Dr. Hines would share some additional information and reiterate the principles around the additional primary dose of the COVID-19 vaccine. Ladies and gentlemen, I'd like to highlight yet again that the percentage of patients in the parallel healthcare system who are not fully vaccinated continues to be high, and currently 4,809 or 5,166 persons, based on data from July 22nd, 2021 to October 20th, 2021, that is 93% of persons, 9 out of 10 persons who have been hospitalized in the parallel healthcare system are not fully vaccinated. And we'd like to take this opportunity to remind members of the public that full vaccination is obtained when a person has a 2-week period beyond the dose of the second dose of a 2-dose regimen or the first dose of the Johnson & Johnson. I'd like to now provide some information on the status of the hospitals in the parallel health care system. This information is as of 8 a.m. today. And yet again, I come to you with very grave and serious news as relayed. And again, I'm asking and appealing all members of the population to please take heed of the information that we are sharing as we continue to see a significant number of persons requiring care in the parallel healthcare system. Now, the Honourable Minister would have indicated on or around September 29th and warned the public that we noted a data point where we saw an increased number of persons in the hospitals. And we monitor that data point as we do. And he did warn the population. Subsequently, Dr. Trotman, myself, Dr. Hines, the Chief Medical Officer, would have all had, in our press conferences, identified the situation that we were noticing and the increasing demand for intensive care unit beds in the parallel healthcare system. This morning, we have now crossed another threshold or marker between the June 28th and present. Up until yesterday, there were less than 400 patients per day in the hospitals in the parallel healthcare system. Yesterday, that 400 number was crossed. There were 405, and this morning there are 427 patients in the parallel healthcare facility. It also meant that over the last 2 days, our occupancy levels, and that is our overall occupancy levels, which were under 40% for 113 days consistently, was surpassed. This morning we are at 47% occupancy, overall occupancy in the parallel healthcare system. And in Trinidad we are at 49%, while in Tobago we are at 33%. I'd like to now share some information regarding the status at the intensive care units, departments in our parallel healthcare system. This morning, there are 52 beds out of a total of 60 beds that are currently operational and activated in Trinidad and Tobago. In Trinidad, 2 out of 5 beds are currently occupied. We continue to see a significant percentage and a significant number of unvaccinated or persons who are not fully vaccinated requiring intensive care unit level care. And this morning, out of the 52 persons in Trinidad who are in our intensive care unit, 46 of them, which is 92% of those persons, are not fully vaccinated. As of 8 a.m. this morning, there were 52 persons awaiting transfer from the accident and emergency departments in the traditional RHAs. 52 persons, I would like to remind everyone. This is a significant increase in numbers, even over the last week. And of those 52 persons, 7 of these persons are receiving intensive care unit level care in the accident and emergencies. Patients continue to present to the accident and emergencies in a severe and critical condition. So when the ambulance is contacted to collect these patients, they have to be placed on oxygen. And upon arrival in the accident and emergency departments, they have to start they are in receipt of intensive care unit level management. Of the 7 persons who are currently receiving ICU level care in the accident and emergency departments this morning, all 7 are not fully vaccinated. This is a consistent trend that we have noticed over the last 23 days since this increased number of persons accessing the A&Es has been noted, and this ties into the increased number of cases that we have been noticed and the increase in the rolling average. Ladies and gentlemen, the Ministry of Health, the RHA teams, our frontline doctors have been trying our utmost best to save lives. Every morning we speak to our doctors on the front line, and they are appealing to you to please take the ministry up on the offer of vaccinations. We are doing all in our ability to manage the increased demand for ICU beds. We have increased capacity at the accident and emergency departments to treat patients who arrive and who are too unstable to be transferred, even if a bed is available. We have increased the number of advanced life support ambulances on each shift, the actual number of ambulances that are placed on each shift. We have increased ICU bed capacity at the Cuba Medical and Multi-Training Facility, the Point Fortin Hospital, the St. James Medical Complex. We have also added ward-level beds. We have reactivated the field hospital at the Port of Spain, out of the Port of Spain General Hospital and at the NWRHA. We've also added beds at the St. James Medical Complex. We are trying our utmost best. But if we continue on this trend, resources will soon be expended. Vaccination is our only way forward, given the presence and the established presence of the Delta variant in our communities at this point in time. I leave you this morning with the 3 promises of vaccination. Vaccination reduces your chance of developing COVID-19 and reduces the risk of transmission. Vaccination reduces your risk of hospitalization and the need for care in an ICU or HDU setting. And vaccination saves lives. Ladies and gentlemen, let us please continue to exercise civic, social, and personal responsibility by ensuring that we and those close to us are vaccinated. Thank you very much, Al.
Thank you very much, Dr. Richards. I now hand you over to Dr. Hines, who will speak on the additional primary dose of the COVID-19 vaccine.
Thank you very much, Mr. Alexander. Good morning to my colleagues, Dr. Richards and Dr. LeBlanc. Good morning to members of the media, members of the viewing and listening public. As we've embarked upon this additional initiative, and we realize that there's still some confusion, a little bit of ambiguity with respect to who understands what about the additional primary dose, we would like to throw that slide up that shows the flyer that will be circulating both on social media and hopefully also in print media that walks us through this additional dosing approach. And we're going to go through it in some detail for those who have not yet heard and those who did hear and require additional detail. So, first of all, the additional primary dose is a third dose for those who have received 2 doses of a 2-dose regimen, or a second dose where applicable for those who received their 1 dose of Johnson & Johnson vaccine. And this approach, the strategy, targets specific individuals in high-risk categories. So individuals who are already fully vaccinated with either 2 doses of Sinopharm, AstraZeneca, or Pfizer vaccine, or the 1 dose of the Johnson & Johnson vaccine, may be eligible for the additional primary dose if they fall into the following categories. For the Sinopharm vaccine, all persons 60 years and over are recommended to have an additional dose 3 to 6 months after the second dose of Sinopharm, or as soon as possible after that. Once we've passed the 6 months, anytime after that, you are eligible. You should be able to go ahead and receive that additional dose. Because the majority of these individuals would already have been recorded in our system and we have the contact information, etc., for these individuals, we will be reaching out to those who have received Sinopharm at the correct time period, the correct time interval, to schedule a vaccination appointment. So everyone shouldn't descend upon the vaccination centers at the same time. You'll be contacted to schedule a vaccination appointment for that additional primary dose. And no referral letter is required because the system is going to be initiated from within the Ministry of Health and the RHAs. Now, in addition to that, with the Sinopharm, all persons who are either moderately or severely immunocompromised, regardless of age, will also be targeted for an additional dose, and that additional dose would be recommended to be taken from 1 to 3 months after the final dose of Sinopharm. Now, again, those individuals fall into specific categories. We went through those in some detail on Monday, and today we will have some additional detailed explanation about one of those categories in particular, and that is the category of individuals on cancer treatment. Dr. LeBlanc will go into that in more detail. But those individuals who are immunocompromised, either moderately or severely, will also be contacted via their service providers, because they would be generally those who are receiving treatment within the public system. Those who are not in the public system will have to get a referral letter from their private physician indicating the nature of their condition, so that they can be scheduled for their appointment. Now that's the Sinopharm. Moving to the next category, for the AstraZeneca, Pfizer, and Johnson & Johnson vaccines, only individuals who are moderately to severely immunocompromised are being targeted for that additional dose at 1 to 3 months after their final dose. So the 60 and over category is only for Sinopharm. It does not apply to the AstraZeneca, Pfizer, and Johnson & Johnson. For AstraZeneca, Pfizer, and Johnson & Johnson, it is the individuals who are moderately to severely immunocompromised who will be targeted for that additional dosing. And as we said, those who are in the care of the public health system will be contacted, and those who are not in the care of the public health system must bring a referral letter from their healthcare provider. Now, as we said before, some of the examples of those with severe or moderate immunocompromise include persons with active cancers, and we'll go into that in more detail today, individuals who received transplants and are on immunosuppressive therapy, persons with certain kinds of immunodeficiencies or conditions or processes that reduce their immunity, and one of the examples given here is those who are on chronic hemodialysis, individuals who are HIV positive with CD4 counts below 200, and persons on other kinds of immunosuppressive therapy for autoimmune and other diseases. Those are the individuals who are being identified as moderately to severely immunocompromised. And those are the individuals who will qualify for that additional third primary dose of the AstraZeneca, Pfizer, and Johnson & Johnson vaccines, and the Sinopharm. So, we hoping to have made that a little clearer. Of course, we'll take questions to clarify anything that remains ambiguous. But at this point, I'll turn it back over to Mr. Alexander, who will introduce Dr. LeBlanc.
Thank you very much, Dr. Hines. And of course, further information on the additional primary dose of the COVID-19 vaccine can be found on the Ministry of Health's website, www.health.gov.tt, and our social media pages. Now, the Ministry of Health has announced that certain categories of immunocompromised persons will need an additional primary dose of a COVID-19 vaccine. This includes persons living with cancer. We go to Dr. LeBlanc for some additional information on this recent development. Good morning.
Good morning, Al. Thank you. Good morning, Dr. Richards, Dr. Hines, members of the media, and members of the listening and watching public, I guess. Good morning. COVID-19 has been with us for quite a while. As Dr. Richards has explained, we are in very serious times with this third wave, with the Delta variant. The Trinidad and Tobago Cancer Society, your national voice against cancer, is here to advocate yet again to all in the cancer community. As Dr. Hines has explained, we have a difference between a primary dose and a booster shot. Right now, we're in the primary dose phase. What does the primary dose mean? It's a third shot to people or others with compromised immune systems who likely did not get enough protection from the first round of shots, and therefore an extra dose will help to better guard them against the COVID-19 infection. Your immune system is your army. It is your defense against all infections. We know that cancer patients who are undergoing active cancer treatment have compromised immune systems. This means you may have been fully vaccinated. However, owing to your status of being in treatment right now, especially with solid tumors and blood cancers, you do need an extra oomph, an extra help, and that is what this third dose is about. We plead with you to get that third shot if it's applicable. We plead with you to speak to your oncology team, as they will direct you and guide you as to when it's necessary. Ladies and gentlemen, I know we have pandemic fatigue. I know we are all getting different types of information. But the reality is that the COVID-19 pandemic is not letting up. The reality is we're seeing much more deaths. The reality is that we have measures that can help to protect us all. We have the 3 Ws and we have the vaccination. We have vaccines available. The World Health Organization has pleaded and has now recommended, apart from vaccine equity to all countries, they've recommended the 3rd shot to certain communities. Dr. Hines has gone through the communities that are applicable to the cancer community. Speak to your oncologists. Have that discussion. Do not be afraid. If you do what you have to do with the 3 Ws, washing your hands, wearing your mask, keeping your distance, vaccination, and getting this 3rd shot, we can protect you from death. We can protect you from hospitalization. This is your chance to actually survive this pandemic. These are unprecedented times. We understand that people who have comorbid conditions, patients, individuals, everyone, the man on the street, we've always mentioned that you're in a high-risk category. So these comorbid conditions, diabetes, dyslipidemia or cholesterol, pressure, cancer, yes, these are comorbid conditions, but they're not necessarily the same as having a moderate to severely compromised immune system. So we ask you to speak with your practitioners if you're in doubt, because having a comorbid condition does not mean necessarily that you are eligible because you think that your immune system is compromised. This 3rd shot is for those who have a moderate to severe compromise of their immune system. We can't be fearful. Apart from all these measures, it's important that we also look at the holistic aspect. Look at your diet. Look at how you're sleeping. Look at your stress coping. But most importantly, when the SOE ends, please don't take this as a free pass because you've had 2 shots to do whatever you want. It is time for us to be responsible and accountable for each other. It is time for us to come together as a country and as a world to beat this disease. We have the tools. Let us use them. All of us in the medical fraternity, especially the doctors, we have committed to an Hippocratic oath. We also observe something very sacred. First, do no harm. We do not come here to give information to cause harm. This virus is amazing, it's novel, but it's also quite dynamic. Research is constant. We are bringing information as it's recommended by our statutory body, the WHO. Let us come together, stop the fighting, stop the discrimination, listen to the advice, and to all of us in the cancer community, remember, if you're getting radiation at this time, chemotherapy, T-cell therapy, if you have a solid tumor or a blood cancer and you're in active treatment, please note that you are eligible for the 3rd shot. Please have that discussion with your oncologist or your team and get it done. I beg of you, please, as Dr. Richards has explained, Dr. Hines has explained, the numbers are going up. We're seeing unprecedented numbers, and we are really trying our best to save lives. I thank you so much, and I beg for your cooperation. Thank you.
Thank you very much, Dr. LeBlanc. Ladies and gentlemen, we now move into the question and answer segment. Our media representatives are asked to state their name and the name of the media house that they represent before posing their question. Of course, because of time, we are asking that we have a maximum of 2 questions per media house in the first instance, and if possible, we will field an additional question from media representatives, that is, if time permits. Our first question, we go first to EZP News. Good morning.
Good morning, Priya Vihari, ezpnews.com. My questions are for Dr. Abdul Richards. Can you give us an idea of the number of ICU beds we have at the various hospitals? For example, how many at Augusta, how many at Cuba, etc. And secondly, the minister had said recently that the field hospital at the National Stadium would have been up and running. Can you say if that is up and running, and also does that have ICU bed capacity? Thank you very much.
Good morning, Priya. Thank you for your questions. I'd like to start with the second question, which was regarding the field hospital operations. And I can confirm that the field hospital at the that is at the National Stadium out of the Northwest RHA and being managed by that RHA is operational. The capacity of that hospital would be at 28 ward level beds. And of course, the hospital was operationalized or reactivated based on the increasing demand being noted on a daily basis over the last 3 weeks or so in the Northwest Territory. Prior to this, additional ward level beds were added to the St. James Medical Complex. The field hospital, a policy decision was taken that the ICU and HDU levels of care would be present and would be made available at the St. James Medical Complex. So at this point in time, the field hospital is being used for ward level care. That is the least critically ill and severely ill of the persons who are entering the accident and emergency departments. Your second question requires a little bit of a breakdown of the number of intensive care unit level beds in Trinidad and Tobago. I'll start with Tobago. In Tobago, there are 5 ICU beds that are operational at the Scarborough General Hospital in Signal Hill, and the TRHA and THA have been working to expand their ICU capacity, which the Honourable Minister spoke about at the last press conference. In Trinidad and Tobago, the following hospitals have the following bed capacity for ICU level care. At the Cuba Medical and Multi-Training Facility, there are 26 ICU level ICU beds. At the Augustus Long Hospital, there are 10 ICU beds. At the Arima General Hospital, 12 beds. At the Point Fortin Hospital, 6 beds. And at the St. James Medical Complex, 6 beds. The need or demand for ICU beds is dynamic. I would like to remind the population that these are the beds that require the most resources in terms of equipment, staff, lab support, and other factors. And so we have been, and as per the Honourable Minister's directive, prior to the onset of the Delta variant, we have been increasing the ICU capacity on a phased basis in line with the demand. However, if we continue on this trend, our resources will soon be expended. So I hope that brings some clarity to your question prior. Thank you.
Thank you very much, Dr. Richards. We go to Guardian Media Limited. Good morning.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. So both my questions are for both the Ministry of Health officials at the table there this morning. Firstly, we're now seeing cases increasing. We're seeing hospitalizations that is increasing. And some people and ex-medical experts are suspecting this is the start or the precursor to another wave of infections. So my question is, what is being considered at the ministry and at the governmental level when it comes to responding to this, with what will be a fourth wave of infection, if it's true? I mean, we have been promoting vaccination and saying vaccination is the way to protect the population, but I mean, that's more of a medium to long term something, whereas this wave is a short term. So what is being considered, and are we considering taking a page out of Singapore's book? And now my second question is, again, to both of you all, what are the numbers, or how many outbreaks have been noted in secondary schools? How many secondary schools have there been COVID-19 outbreaks? Now, Dr. Hines, I know earlier this week, or was it late last week, you deferred that question to the Ministry of Education. However, the Ministry of Education is deferring that question back to you at the Ministry of Health. So any more information on that? Thank you.
Okay, so let's respond to the first bit of the question that you asked with respect to the increasing numbers and the planned response. You partially answered your own question, but I'm going to disagree to some extent with your assessment that the vaccination is a long-term or medium-term solution. The vaccination solution is actually an immediate-term solution, because as soon as you are vaccinated and you begin to reduce your risk, you as an individual improve your chances of not ending up in the hospital. You also reduce the burden on the hospital system. So that is not just medium or long term, that's actually immediate term. And as the numbers evolve, unfold, as we see the direction and the speed at which this wave progresses, then the relevant information be taken into account by the decision makers in terms of what additional strategies would be taken, what additional strategies or approaches would be taken. So that question of what will be done is really, it's preemptive to us that at this point in time, when the decision makers have concluded based on the existing information which direction to go in, that information will most certainly be provided from that level. And moving to the second bit of your question, now there was a bit of information that had been shared with respect to numbers of cases across the board. Now, it does not really specify, for example, numbers of schools, etc. And it is definitely better for the Ministry of Education to publish that particular piece of info, as I'm looking for it here. Publish that piece of info with the additional context that they have. But we do have a nice little summary so far that what we will do is, with the Ministry of Education's permission. Sorry? Okay. With the Ministry of Education's permission, which I'm now understanding that we do have, we can run through this and then we can refer to them to host it on their website. So they put the information together a little bit differently. They have districts that we don't have in our particular setting. So they have Port of Spain and Environ, St. George East, Northeastern, so they don't correspond directly to our counties. Nonetheless, up to November 5th, the data that they've shared with us gives number of cases reported for follow-up, number of confirmed positives, confirmed negatives, and pending those primary contacts pending confirmation. Well, I'll run through for the sake of brevity and allow the information to be shared afterwards. I'll run through the confirmed positives by these districts. So for Port of Spain and Environs, there were 5 confirmed positives up to November 5th. For St. George East, there would be 16. For Northeastern, 12. For Caroni, 3. For St. Patrick, 7. For Victoria, 5. And for Southeastern, 7. These are the confirmed positives in each of those districts. Now, the question you asked really reflected how many schools, etc., and that information wouldn't be in this this particular summary. But this is the summary that has been shared thus far, and additional detail on this can, of course, be sourced from the Ministry of Education. So I think we'd leave that there for the time being and undertake to share this, as it has been shared, this particular slide on our website as soon as possible.
Thank you very much, Dr. Hines. We quickly go to TV6 for your questions. Good morning.
Hi, good morning to the panel. Alicia Boucher from TV6 here. My first question is for Dr. Richards. Dr. Richards, I'm wondering, what is the average time frame that it generally takes for patients in ICU to be transferred from the traditional healthcare system into the parallel healthcare system, and how is this situation affecting those who might need ICU care in the traditional healthcare system? I don't know whether or not it has begun to have that kind of an impact. And my second question is for Dr. Hines. For the category of persons eligible for the 3rd primary dose, seeing that they would not have triggered that kind of immune response needed, and that's why they're being given that dose, does it now mean that they are not considered fully vaccinated with the 2 doses that they would have received before? Thank you. And and I just want an update on how many 3rd primary doses have been administered thus far.
Okay, good morning. Thank you, Ms. Boucher. The transfer of a patient from the Accident and Emergency Department to the intensive care unit ward is multifactorial. So a bed, I'd just like to reiterate that a bed may be available in the parallel healthcare system, but the patient may not be stable enough, that is clinically stable enough, to place on a portable ventilator and to have that patient moved by ambulance from an accident and emergency, for example, from the Eric Williams Medical Sciences Complex to the Couva Medical and Multi-Training Facility. The time the duration of time that is required varies based on the clinical status of the patient, the availability of an ambulance unit and an advanced life care support units ambulance, which is a higher spec ambulance, the availability of beds in the parallel healthcare system. But I'd like to reassure you that the patients in the accident and emergency departments are undergoing and receiving the same level of care that has been discussed as per the RHA's guidelines on managing persons with COVID-19 that require ICU care. So they are being treated in the isolation units or the biocontainment units of the accident and emergency departments. Your second part of the question was an inquiry as to whether the current situation is affecting persons in the traditional healthcare system. And I can confirm that persons are not being denied ICU care for non-COVID reasons in the traditional healthcare system because of the increased number of patients at this point in time. Now, that is very relevant at this point in time. The parallel healthcare system was designed, developed, and has been adapting and evolving to protect the traditional healthcare system. And as of this point in time, there are 60 operational ICU beds in Trinidad and 5 in Tobago. So patients continue to receive care in the traditional system for non-COVID diagnoses, as well as the COVID-19 patients in the A&Es. Thank you very much.
Thank you very much, Dr. Richards. We go across to Tobago now, Radio Tambourine.
Actually, the second question that was directed to me, and I believe that was with respect to full vaccination. And it's an interesting question, so I do want to make sure we answer it. The question was whether someone who has had the second dose and it requires an additional primary dose of vaccination, whether that individual would not be considered fully vaccinated. And while it is to some extent a little bit semantic, the answer would be yes. At this point, because we have identified individuals whose sustained immune response requires an additional primary dose, until you get that additional primary dose, you wouldn't really consider yourself to be fully vaccinated. And again, this is a dynamic field, as Dr. LeBlanc pointed out, as we've said before, as the research comes through on how well your immune system responds in the first place, how well your immune system sustains that response, and how long that response can be sustained for. All of this information is then going to modify what qualifies as fully vaccinated, the frequency with which additional vaccinations may or may not be required. So that's an excellent question. It's a question that will be subject to update as additional data becomes available. It's a very good question to ask. With respect to the rollout of the additional primary dose, I don't have the exact figures in front of me. I know that there were in excess of 100 doses that had already been distributed at my last check, but we will undertake to provide that information to the public via the Ministry of Health website subsequently with the exact number.
Thank you very much, Dr. Hines. Clayton Clark, Radio Tambourine, we are ready. Okay, so next we go to Newsday. No Newsday.
Good morning, everyone. Rihanna McKenzie here from Newsday.
Right. Good morning.
My first question is for Dr. Hines. So I am hoping for a bit more information on a gene that has been identified that is said to double the risk of respiratory failure and death from COVID-19 in people of South Asian heritage. Have you received any further information on this from the WHO? And if so, is it a factor in the COVID-19 infection and death rates that we're seeing here? My second question. Can you provide an estimate on the number of COVID-19 cases coming out of schools as students are now back out, both vaccinated and unvaccinated? I understand that the Education Ministry will be recording this information, but would you consider maybe a joint briefing with the Education Ministry to address this, because we are seeing some spread happening in schools?
Okay. Could you repeat the question? We weren't hearing clearly at all.
It's very, very muffled.
Yes, but
Okay.
please repeat the question. Please speak a little louder.
Okay, sure. Well, which question? The first or the second question?
Just the brief point, the brief question on both. What was the question in each case?
Okay, sure. You're hearing me a little better now,
A
right?
little better.
Okay, so I was hoping for a bit more information. This is for Dr. Hines, on a gene that has been identified and is said to double the risk of respiratory failure and death from COVID-19 in people of South Asian heritage. Have you received any further information from the WHO on this new development? And if so, is it a factor in the COVID-19 infection and death rates that we are seeing here? My second question, can you provide an estimate on the number of COVID-19 cases coming out of schools as students are now back out, both vaccinated and unvaccinated? I understand the Education Ministry will be recording this information, but would you consider maybe a joint briefing with the Education Ministry to address this, because we are seeing some spread happening in schools?
Okay, heard the questions better this time. Thank you. So, with respect to that genetic risk, we are aware of the information. The information has been published, but as I'm sure you are aware, we're not doing any sort of genetic screening of our population, so we can't see the extent to which that gene would or would not be present or prevalent within our own population, and therefore we can't really estimate the extent to which that may or may not affect what we're seeing right now with regard to COVID-19 spread or with regard to the effects of the Delta variant. And again, because that's more, it's an interesting point, it's an academic point, it's something that may be useful for research, but it's not so much a thing that can be applied practically in the response to the health system's response to the threat of COVID-19. What can be practically applied is the additional uptake of vaccination, and that, regardless of your genetics, that will provide you some level of risk reduction, in addition to which all the other public health measures layered one on top of the other, the mask wearing, the hand washing, the avoiding of the crowded spaces, all of those behaviors together will reduce your risk regardless of what your genetic makeup happens to be. So we will be focusing more on those things that we can intervene on in a practical manner, while taking note of the interesting academic factors around the genetics that have been published so far. Now, with regard to the second question, you're quite right. Details of that nature would definitely be details that would be released by the Ministry of Education. We ran through earlier the numbers by what they call educational districts, and as we said, we will host that slide is shared with us on the website for future reference. But in terms of the numbers vaccinated versus unvaccinated, that would be for the health team that works with the Ministry of Education to provide additional detail on.
Thank you very much, Dr. Hines. We go to azpnews.com for an additional question.
Good morning again, Private Harry, AZP News. Dr. Richards, you have said in the past that people sometimes present themselves to the E&E when their symptoms are very severe. There is a problem with the number of ambulances we have that provide that service. People are waiting hours to get their transportation to hospital. Is the ministry concerned about that? And is there any sort of plans to use the other ambulance service, for example, from the fire service, to get people to hospital now, rather than only depending on GMRTT? Thank you very much.
Thanks again, Prior, for that question. The Ministry of Health continues to collaborate and work with the GMRTT service to ensure that the required number of ambulances are deployed on every shift. And of course, more ambulances are deployed on peak shifts. And we do real-time monitoring with the GMRTT as our contracted service provider in the public service. The Ministry of Health, through the regional health authorities, also uses the RHA ambulances, for example, for transfers between facilities. So patients would contact the 811 hotline, and they would be screened and assessed. And of course, we have a clinical team that works alongside the GMRTT, that is doctors who are on call, specialists, primary care physicians, and persons who would be communicating with Dr. Trotman and other members of the overall clinical management team. But we additionally have RHA ambulances that would move patients. For example, if a patient needs to be transferred between the San Fernando General Hospital Accident and Emergency to the Point Fortin Hospital, or within the ERHA, from the ERHA Sandy Grande Hospital to the Eric Williams Medical Sciences Complex. So we are continuing. Again, it's a demand issue. We are doing all in our part at the government level, the Ministry of Health level, and the RHA level. But the onus is now on the population to please reduce this demand, given the limited supply of ambulances and other resources. Reduce this demand by please becoming vaccinated. Let's take the ministry up on that offer of being vaccinated to prevent yourself or a loved one from having to contact the ambulance to be transferred to an accident and emergency. Thank you.
Thank you very much, Dr. Richards. We go to Guardian Media Limited for another follow-up question.
Good morning again, everyone. So my follow-up question, it was part of my initial questions that wasn't answered. But to what extent, or is it even being considered locally to implement a similar measure as what is being implemented in Singapore, where unvaccinated people are now being asked to pay for hospital spaces? And I ask that against the backdrop of our very limited amount of bed spaces, especially in the ICU.
Okay, thank you. You would note that I actually did answer your question by saying that any additional changes in policy would be announced by the decision makers. So we will leave that question there.
Thank you very much, Dr. Hines. We go across to TV6 for a follow-up question.
Hi, good morning again. So we got an update on the number of vaccinated versus unvaccinated in both the overall healthcare system, the parallel healthcare system, as well as ICU. And I was wondering if we can get an update on the number of deaths vaccinated versus unvaccinated that we've had so far.
Okay, so that information is info that we keep updating basically on a daily basis. We have to go back through records, sometimes go back and verify vaccination status, vaccination cards, etc. in the newest sets of death. We were actually planning to update that particular statistic at the next Saturday conference. So give us until then to have the newest set of information verified, which does require us to sometimes go back to records or ask the doctors to send additional information so that we can verify the actual vaccination status of the newer set before we update that statistic.
Thank you very much, Dr. Hines. We have come to the end of today's media conference. Remember that we all have an important role to play in protecting Trinidad and Tobago from COVID-19. Keep making the responsible decisions to follow the health guidelines, including wearing your mask, washing your hands, social distancing, and of course, let's vaccinate TNT. Goodbye for now.
Good day, TNT. My name is Miss Isabel Julian, and I am urging the public to please go out there and take the vaccine. I have taken the vaccine. I have no complication. I have no problem. In order for us to get herd immunity, we have to take the vaccine. I have my grandson home. I have my son, my children home. I would not like to carry the virus home and infect anyone. I am begging you, TNT. We have the frontline workers, the nurses, the doctors. They are all doing their part since 2020. Let's vaccinate, TNT.